Hi, good morning. So right now I'm going to perform an incentive spirometry. So first and foremost, we always check the patient's chart and make sure we obtain the information such as an order that it needs to be given an incentive spirometry. And then with the device, make sure we inspect it first. If there are any defects or cracks on it, if there is, make sure we should replace it with a new one. So once inside of the patient's room, we have to explain to the patient and introduce them what we're going to do, and then we have to check the patient's ID band to make sure they are the correct patient, and then after that we obtain vital signs, make sure we always auscultate it, and then while obtaining vital signs, after that if the patient can position in a sitting upright position, that would be better. If not, we can just position the head kind of a semi-upright so that we can perform it the correct way. So after that, we wash our hands, and then moving on, we can explain it to the patient. So assuming I am the patient, I will explain it to the patient. Hi, Mr. Anthony. Doctor prescribed you an incentive spirometry. So this one, it would help you expand your lungs, especially you just came from surgery, to prevent any atelectasis or collapse of your lungs. And then at the same time, because I've noticed you've got multiple secretions, it would also help you cough even more and remove secretions. So first and foremost, if I am sitting upright, I'm going to exhale all the air out just normally until I feel my lungs are empty. After that, with this being hooked in the device, the mouthpiece should be put inside your mouth and then should be sealed with your lips, and then your tongue should be below with this one. You will do a slow deep inspiration, hold our breath with about 3 to 5 seconds until we notice this white piston to drop, and then once it drops back to 0, we remove the mouthpiece and exhale again normally. And then every time we do this therapy, make sure so that the patient will understand, it is recommended that we always demonstrate in front of them for them to fully understand. So assuming I am the patient here, and then there's a chart that's included with this one. So based on my height and my weight, age, mine is about 2000. So if the patient also has any pain present, we can also put a pillow in front of them so that there is something that could support, especially if they feel any pain in their chest, especially if it came from surgery. So assuming I will start it, I will exhale the air out. This one. So every time we do this one, we have to let the patient rest for a few seconds, and if you can do it another one, we can do another trial. And then ideally, when performing this, it is good to perform about 10 times, especially waking hours only. And then it is also ideal to perform every hour, but especially if the patient is asleep, we should not perform it to them. And then for this one, it is also indicated to those patients who are able to understand this one or cooperative, and then as what I mentioned earlier, fully awake. And then once we done doing this, we have to put it back to the safety bag. And then with the mouthpiece should be covered with a clean tissue, and then should be put it inside, and then position it in an upright position. So assuming this one is inside, and then every time we're done doing the therapy, we have to do another auscultation, and then after that we obtain vital signs, and then we always make sure we let the patient cough after doing the therapy. And then once we're done, we reposition the patient, obtain any information such as if the patient's level of consciousness. And then another thing is that every time we do with this one, if we sense the patient or complains like they have any dizziness or any complications, we should stop the therapy, and then we include it with our documentation, and then